Is it recording? Yeah. Okay. Hi everyone, my name is Erica Hernandez and this is my partner Marissa. We decided to do our project on the triangular fibrocartilage complex, but more specifically the type 1A lesion and rehabilitation.
We'll also just be referring to it as the TFCC. So our patient is Mike. He's a 25-year-old active male, and he works full-time as a carpenter and is the sole provider for his family. On the weekends, he loves to go fishing, do anything outdoors. He is right-hand dominant, so he heavily relies on this hand for work, for throwing his rod, everything that he loves to do. So Mike's mechanism of injury happened while he was fishing. He was on a steep bank, and when he turned to grab another piece of bait, his foot slipped on the rocky, muddy terrain, and he fell on an outstretched hand. After pain persisted for a while, he decided to go see a physician. They ordered an MRI, and it was found that he had an injury to the TFCC, which was classified as a type 1A lesion by the Palmer's classification system. So the TFCC is just a complex of ligaments, subtendon sheath, a lot of stuff. It's mainly just to stabilize the ulnar side of the wrist while still allowing for a large range of motion of movement. The type 1A lesion happens in the central region of the disc, the TFC disc. So when an injury happens to this area, it is a cause for concern because there is no vascularization in there, and which means that it is very hard to heal on its own and would need some type of intervention. So manual muscle tests were performed when he came into our clinic. We were just trying to get a baseline to see where he was at. He was lacking in strength as far as his wrist flexion, extension, ulnar and radial deviation, and some pronation supination. We also took some GONI measurements to see where his range of motion stood, which he was also lacking, as you can see right here, in all four directions. We were also wanting to see if he had any swelling. So when we took a girth measurement, it was found that his right wrist, which was the wrist of injury, was 4 centimeters larger in girth when compared bilaterally to his left wrist. And his pain was also a 7 out of 10 when he came into our clinic.
So when opting to have surgery or not, with this specific injury, with a non-surgical option, what they usually do is they put you in a splint or a cast for 4 to 6 weeks, then take you through a general range of motion and strengthening program. Cases have shown that people who decide to not withgo the surgery tend to end up having it just because of the persistent pain from that lesion. Now, when choosing to have the operation, you need to make sure that your patient is aware about the tissue healing, as well as that will be a factor within their rehab, whereas that wouldn't necessarily have
happened in the conservative plan.
Yes, exactly. And in Mike's case, specifically since he is the sole provider of his family, he needs to get back to work as soon as possible. He doesn't necessarily have the time to try the more conservative and the surgery option as well. His physician just said, go ahead, have the surgery, save you some time and go through a rehab program.
And since he did have a type 1A lesion, surgery was kind of his only option, again, because that area is avascular and it wouldn't heal on its own. Surgery would be his only option.
So for our phase 1 rehabilitation plan, we wanted to address a lot of his pain and swelling using cryotherapy, e-stim, myofascial release to address those scars from surgery. We also want to decrease his pain and swelling as noted in our short-term goals as well. Moving on to phase 2, which is our range of motion component, we want to look at those motions where he was lacking, that flexion, extension, all of those, pronation, supination, everything. A couple of short-term goals that we listed here, although not all of them, were to increase his wrist flexion and extension, as well as ulnar deviation, all by March 27th. A couple of exercises you can do are, just hand windshield wipers, mainly trying to look for that wrist motion, stabilizing the wrist. Ins and U's with the TheraBand bar, which we have pictures of later on in the presentation, working on that ulnar and radial deviation. We also have the TheraBand Power Web here. Marissa can tell you more.
And that one's really good. You can put your fingers in and work on finger flexion, finger extension, and then also work on some rotation against the resistance. Anything with the TheraBand bars web, very easy to progress since different colors have different resistance. It's easy to carry on throughout his plan of care and make it a little bit more difficult.
Lastly, we just have the wrist dexterity tool, which is up near Marissa. Do you want to go ahead
and that one's great also. It works range of motion in all directions. You just stabilize your wrist and really try to get these little metal hoops.
Rings,
yeah, metal rings throughout the entire course of the wrist dexterity tool.
And then of course noting the TheraBand bars there as well. In phase 3, our strength component, we're still looking on those 4 motions in which he was lacking, as well as pronation, supination. The short-term goals listed, although a couple, like I said, addressed those insufficiencies with his flexion and extension. We also want to get him up to a 4+ with his ulnar deviation, and look at his grip strength as well. We want to incorporate rotational and weight-bearing exercises. A couple of exercises you can do here. Easily the TheraBand, very easy to progress as well with the colors. You can use leans on the table, shifting weight from the non-affected side to his affected side, progressing him onto a partial weight-bearing wall plank, then from there taking him into a push-up, from there taking him onto the floor whenever he's ready, and for grip strength as well, looking at twisting lids onto a jar and off of a jar.
Easy to add into his home exercise plan as well. So during phase 4, we really wanted to be a little bit more activity specific, make sure he was ready to get back to work, back to fishing, doing what he loves to do. We wanted to work on plyometrics. Since he's a carpenter, he's always getting a lot of force within that wrist. So one goal we had was him hammering into an Air-X pad for 2 minutes without pain. Should that bring back on pain, it would just kind of cue us that he wasn't fully ready to return to work and for us to continue working with him. So one of the exercises we did here would be throws at a trampoline. So you could do it single arm or double hand overhead, making sure to really catch that ball and again, just get him used to that force coming back into his hand. And then we could also do push-offs off the wall. Again, just getting that impact, getting him used to that impact. And then we have a rope with the weight at the end, which Erica can explain.
Yeah, and so with the weight at the end, the other end of the rope, of course, attached to either a cane or pole of some kind to kind of simulate a fishing pole. As well, the clinician from there can just push the weight in various directions to simulate him reeling in a catch to where the patient will have to resist, all types of motions, which is more activity specific to his fishing needs.
Yeah, and so we're just hoping by phase 4 that he is ready to go back to work, ready to get back to all of the things that he loves to do, which is our ultimate goal.
Yes.
And then Erica will pull up our references. And that's it. Thank you.
Thank you.